Yes, we're here on the roof of our Bureau building just across the street from the Capitol, and I'm here with Matt Boyle, who is the Washington political editor for Breitbart News. And Matt, thank you for talking to One America News. I wanted to talk to you a little bit. I know you've been following an issue. It has had many twists and turns over the last few months, is the health care bill. I know you've had conversations with Chairman Mark Meadows, Chairman of the Freedom Caucus. What's going on with the health care bill right now, as far as you understand?
So we're potentially going to see a vote on a new health care bill, not the American Health Care Act, which was the failed bill originally offered by Speaker Paul Ryan that was unable to garner enough Republican support to pass the House of Representatives. What's happened since then, after they pulled the bill, is that Chairman Mark Meadows, the chairman of the House Freedom Caucus, and Tom MacArthur, who's a congressman from New Jersey, and he's the co-chairman of the moderate group. It's basically the Freedom Caucus for the moderate guys, right? It's called the Tuesday Group. So Tom MacArthur and Mark Meadows have gotten together and negotiated out a fix, that a new bill, a series of compromises from both sides that likely could pass the House of Representatives.
Now, it seems to me there were a couple of stumbling blocks for the Freedom Caucus guys. One is these essential benefits and some mandates that were in the Obamacare piece and were in the Ryan leadership bill. But now they seem to have had a compromise on that piece. What is the compromise language?
Well, the big thing that you'd hear from the Freedom Caucus that they're most concerned with is, and this would be the same thing you hear from conservatives in the U.S. Senate, guys like Tom Cotton, Ted Cruz, Rand Paul, Mike Lee, all raised concerns with the Ryan bill originally as well. So the reason why they were raising concerns is because of the fact that the Ryan bill originally wouldn't have lowered people's health care premiums. This new bill is designed to do that, and it's designed to give states, from what we're seeing off of early reports, we don't actually have the text of the legislation yet, but we're hoping it comes out soon. But we're hoping that this new bill will actually give the states the flexibility to custom craft market-driven programs to be able to lower people's premiums, because that was the big problem with Obamacare, is that despite the title, the Affordable Care Act, it was anything but affordable for people. It significantly raised people's health care costs.
And of course, the Freedom Caucus guys said that you were charging for some services a lot of people didn't use or didn't want or didn't need.
Right, exactly. So what they have to do is they have to find the right mix of making sure that people don't lose their health care, and there were popular parts of Obamacare, things like the covering pre-existing conditions, or kids being able to stay on their parents' plans until they were 26. Things like that are very popular, and they're unlikely to become unpopular. So they have to find a way to incorporate that stuff into a plan that also lowers people's premiums. That is the number one goal of House Republicans, especially conservatives, is to lower people's health care premiums so they're paying less for health insurance. But they still have health insurance, right? And so that's the impetus here. That's the key thing that these guys are negotiating on. The reason why there's a chance for success right now is because of the fact that the chairman of the House Freedom Caucus, Mark Meadows, as well as the co-chairman of the Tuesday Group, Tom MacArthur, have gotten together. Paul Ryan, the Speaker of the House, who's very, very unpopular across the country right now, has taken a step back. He's not been really involved in this. He was out in Hollywood. He was over in Europe while this whole thing has been going on. And so as long as Paul Ryan stays out of the picture here, they have a chance at passing an Obamacare repeal and replace and following through on President Trump's campaign promise to repeal and replace Obamacare, and they might even be able to do it in the first 100 days.
So do you think that there potentially could be a vote or something, or maybe an announcement or text of a bill next week, or what do you think might happen?
I think we could potentially, as early as this weekend, get text of the legislation, and potentially next week there could be a vote. I think they're still working out the specifics. They learned the hard way the first time around that you can't just ram something like this through, that you need to make sure you have buy-in from all the different sides of the Republican conference. You can't just throw a bill out there and expect everybody to support it, just because Paul Ryan says to support it. So Paul Ryan proved himself to be incapable of managing to pass legislation through a Republican-led House of Representatives last time. This time they have to do it differently. So hopefully we will have text. People will be able to digest it. It will match the talking points. That's an important thing. The text of Ryan's bill did not match his talking points. And people will have enough time to digest it, and we'll be able to deliver a bill that actually does repeal and replace Obamacare, follows through on that promise, but also lowers people's healthcare premiums. That's the most important thing that happens in this in this larger equation.
So it looks like there actually might be a healthcare bill. It looks like we might have some agreement. It looks like there's real progress on that front, which actually leads into my next question for you. President Trump has been criticized by many people in the mainstream media already. The first 100 days, I believe, as you mentioned, it ends next Friday or Saturday, I think, technically or officially, first 100 days of the administration. Talk a little bit about his record for the first 100 days. What is your impression of his accomplishments, particularly since he may have some success on the healthcare front?
Well, I mean, I think that's going to be, we don't know yet on healthcare, but if you look overall, I think there's been some successes, there's been some setbacks. He's definitely trying to implement the agenda that he campaigned on. He certainly, I think, deserves an A+ for effort. There's no doubt about that, but he's found a swamp here in Washington, a deep state, an administrative state that is desperate to try to undermine him. In many of these agencies, what we're seeing is a bureaucracy that is entrenched and built in, that is working overtime to try to stop the implementation of what President Trump campaigned on, because essentially what he campaigned on is that the bureaucracy is not working, that Washington is not working. And so that jeopardizes the livelihoods, if you will, of the political class, the people that live high on the taxpayer dime. Ultimately speaking, there have been a number of successes throughout the course of the first 100 days. First and foremost, in the first week, he nuked and got rid of the Trans-Pacific Partnership. That was a huge deal. He's been rolling back the administrative state, cutting into the bureaucracy. His cabinet is working very, very hard to implement a lot of different things. What we're seeing out of Attorney General Jeff Sessions and Homeland Security Secretary John Kelly, when it comes to immigration, they've significantly lowered illegal immigration numbers into the United States, and they're making a huge impact on that front. This past week, what we've seen is the president has asked Commerce Secretary Wilbur Ross to look into China's illegal steel dumping into the United States and the effect that has on our infrastructure and on our economy and on our national security, most importantly, especially as we're seeing a buildup in the military. In addition to that, we're seeing significant efforts from the Defense Department and the national security community when it comes to targeting terrorism on the world stage. All of that combined are successes, but there are setbacks too. There are things like the healthcare bill has been tough. He's had a difficult time getting things through Congress, with the exception of the confirmation of Judge Neil Gorsuch, now Justice Neil Gorsuch, to the Supreme Court. So we're going to see after the first 100 days, when the story is written about this, how is President Trump going to learn to navigate Washington a little bit better? He's one of the best managers of a bureaucracy that we've seen in our modern era. So how can he apply those skills that he had running the Trump organization to now running Washington? And this is a significantly bigger organization. There are 3 million employees of the federal government, and President Trump only has the ability to fire or remove about 4,000 of them. 4,000,
that's right. Well, I think that's a very insightful comment. President Trump perhaps having more success in the first 100 days than he's given credit for, certainly with regard to the executive orders he's issued. Also, I think he's made some friends on the Hill, Lindsey Graham notably, Ted Cruz, others who seem to have become invested in the success of his administration. So there you have it, talking about healthcare and the first 100 days of the Trump administration, here with Matt Boyle, who is the Washington political editor for Breitbart News. I wanted to be sure to get that title exactly correct. And so we'll send it back to you in the studio from the roof of 101 Constitution Avenue.